endometrial cancer is the fourth most common cancer among women in the U.S., and weight loss has been shown to reduce the cancer risk. Dr. Steve Herman and Abby Kyland join us to talk about how Profile by Sanford could help higher-risk women shed the pounds. Welcome to the show.
Hey, thanks for having us.
Yeah, thank you. So, Dr. Steve, can you discuss your role? You're the Senior Director of Innovation and Research. Can you tell us a little bit about what that means?
Yeah. Well, I get a really fun job. I get to work with our training programs for our coaches to make sure that they have all the tools and skills that they need to provide a great experience, whether that's motivational interviewing tactics or just nutrition, exercise, and behavior change background. And then I get to go out and work with other physicians and research partners inside of Sanford Health, and then also around the country to understand how can we manage our members better, get them better results, improve their health more effectively. And so it's every day is different and always exciting.
Well, that's great. And it seems like you're very passionate about what you do. You did a recent, you have some recent findings that you discovered some things between endometrial cancer and weight loss. So can you discuss a little bit about, those findings?
Yeah. So this one's really exciting. There's a lot of research out there with weight as a risk factor for a number of cancers. We also know that losing weight and getting healthy and improving your nutrition and exercise can lower your risk of cancer recurrence after treatment. And so working with some Sanford physicians, the conversation was that we need to do better with the patients that we have. And so we said, well, let's try this. So we enrolled about 22 women into a 12-month trial with us, and the results were phenomenal. They lost over 35 pounds and had kept it off over the entire 12 months. And this is just the first step. The next step would be to follow these women and other women longer term to see if we can reduce the risk of recurrence.
All right, and the purpose of this study then was, to see how Profile works, or can you explain that a little bit?
Yeah, so we wanted to compare to the usual care. And I understand that when these women go through treatment, after treatment, they're counseled in a primary care setting or in a physician setting to lose weight, improve their nutrition. And that can be really difficult to do when you only get a few minutes between the doctor and patient. And so at this, we wanted to do better. That usual care can produce some weight loss, some great results in some women, but on average, they only lose a couple of pounds over 12 months. So enrolling in a program like Profile, where you get to meet with a health coach on a regular basis, weekly, you get to talk about all the challenges and struggles that you might be having, the wins along the way, and you get that constant reinforcement.
So now, would this be for women, like for preventative care, one, but then also if she does have endometrial cancer?
Yeah, so from a prevention standpoint, we know that losing weight can help reduce your risk for a whole host of cancers, but endometrial cancer and breast cancer in particular. So just losing 10 pounds can have an impact. And then if someone does find out they have cancer, want to make sure that they go through meeting with their physician, their full treatment plan. And then after that, when they're ready, then we can work with them after their treatment's complete.
All right. Well, thank you for so much information. I guess I thought Abby was joining us, but I'm glad you were here. So thank you, Dr. Steve, and for all your findings and for your passion.
Thanks a lot.
Coming up on today's show, an event at Buffalo Wings and Rings to help kids at a local hospital. Stay with us.